Every surgeon I've worked with has one thing in common. They know how to work hard and they rarely know how to shut it off. That drive is impressive, but constantly being on comes at a cost. Chronic muscle tension, stiffness, chronic aches and pains. One of the things I have my surgeons regularly do is a self-myofascial release routine with a high-density foam roller and lacrosse ball. Over the next few minutes, we're gonna go over the 4 areas that are must-dos on the regular for your soft tissue routine. But first, let's cover what's going on with foam rolling. Let's start this off by stating the research shows a mixed bag as far as the efficacy of foam rolling goes. But there is research that has shown benefits for pain modulation, acute increase in range of motion, and reducing delayed onset muscle soreness. It's also been hotly debated about the mechanism in which foam rolling works. Some say it's actual structural adaptation to the tissues. Some say it's decreasing sympathetic output. Whatever it is, we can assume that it's some sort of mechanical and neuromuscular adaptation that's occurring. In my experience, some clients swear by using it. Others think it's a waste of time. For me personally, and the surgeons I use foam rolling with, it helps decrease the amount of tension we walk around with and results in better movement in the case of where a specific joint is limited. Now let's get into the 4 areas that you should be doing regularly as a surgeon. Number 1, plantar fascia. You're on your feet the majority of the day, and in all likelihood, you're putting lots of stress on your plantar fascia from being in the OR all day long. By rolling your plantar fascia with a lacrosse ball, this will help not only keep your feet healthy, but helps take stress off your Achilles tendon as well. Use the lacrosse ball for this area. Number 2, long head of your biceps femoris. Start just superior to the ischial tuberosity and slowly roll down on the lateral aspect of the posterior thigh until you reach just above the backside of the knee. Standing in front of the operating table throughout the day, you're likely shifting your center of gravity to the balls of your feet, which will be driven by the muscles of the posterior hip concentrically contracting. This can lock up the pelvis and make it so you have lingering tension and achiness in the SI joint area. Rolling the long head of your biceps femoris will help release the tension in the posterior pelvis and give you some relief. Number 3, the vastus lateralis. Start at the top of your hip near the hip pocket area. Roll down toward your knee on the outer portion of the front of your thigh. Number 4, pec minor. Rounding over the operating table and exerting force as you cut, saw, and use other tools can create a lot of tension in your pec minor. Use the lacrosse ball to help release all that tension and you'll feel more loose through your shoulders. Make sure you go slow and spend about 60 to 90 seconds on each area. The lacrosse ball will be used on the plantar fascia and pec minor, and the foam roller for your biceps femoris and vastus lateralis. If you want videos where I coach you through each one of these exercises, then comment soft tissue and I'll send them over.